The hospital was founded in 1588 by the Archbishop of Milan, Gaspare Visconti, and was initially managed by the monks of the Fate Bene Fratelli order. Currently, the hospital, named Fate Bene Fratelli, is a highly specialized public hospital and is located in the city center of Milan. The cardiology unit plays a crucial role in the hospital, offering the patient the latest available technologies. It covers the whole spectrum of non-invasive and invasive diagnostic examinations. There are indeed 2 rooms of echocardiography, one for ergometer tests and 2 rooms dedicated to invasive studies interventions, one electrophysiology laboratory and one cardiac catheterization laboratory. The cardiology department has 18 standard beds and 6 beds for the coronary intensive care. In addition, a room is dedicated to outpatient and paying patients. The Cardiac Catheterization Laboratory offers a variety of diagnostic and interventional cardiology procedures used for the treatment of coronary artery in a dedicated latest generation room and peripheral artery disease. The staff, led by Dr. Romano Seregni, consists of a staff of 15 cardiologists, 35 nurses health professionals, and a psychologist. The catheterization laboratory is led by Dr. Pedro Silva and consists of 4 cardiologists, including the director, and of 7 dedicated nurses. The heart pumps oxygenated blood through the vascular system to the entire body, including the heart muscle itself. The heart receives its own supply of blood from special vessels, the coronary arteries. The activity of our cath lab is mainly focused on the study and treatment of coronary vessels. For this purpose we have, in addition to traditional images as angiography, the most modern technologies of investigation, such as intravascular ultrasound and optical coherence tomography. Moreover, functional assessment of the coronary flow is also possible. All of these techniques help cardiologists in the evaluation and decision treatment of coronary and peripheral artery disease. If you prefer, you may choose to perform the coronarography and eventual intervention as a paying patient with a dedicated physician from our staff. Coronary catheterization consists of a several injection of X-ray dye into the arteries, allowing doctors to view and record images in a digital movie. When the coronary catheterization is completed, along with the knowledge of clinical backgrounds of the patient, a therapeutic decision is taken, which is explained and totally shared with the patient. There are 3 therapeutic options. The first is conservative and consists in the management with the medical therapy, usually the last chance and considered when the next 2 are scared, and the other 2 invasive. A percutaneous intervention, the most common option, which consists in opening the vessel with a balloon or positioning a stent. The last by a bypass surgery. In the latter case, a cardiac surgery deal with another hospital is requested. In any case, before performing the coronary catheterization, blood tests are checked in order to confirm the correct indication for the examination that will take place. The examination is performed by a puncture in local anesthesia of the radial artery located in the wrist area, our first choice in 90% of cases, or the femoral artery. Thereafter, a cannula is introduced in the radial femoral vessel, into which the therapeutic options are introduced and pushed toward the coronaries. If therapeutic indication is a percutaneous one, usually performed immediately after the coronary angiography, in the same session we place a guide wire inside the coronary, and above it we slide the balloon to dilate the vessel, and eventually placing a stent to keep the vessel open. In selected cases, a new intervention will be programmed to complete revascularization. After catheterization, it's very important that you follow the rules for preserving the site of puncture. At the time of discharge, it's crucial that you follow exactly the prescribed medical therapy in order to avoid the acute occlusion of the vessel and the need for intervention. The Interventional Cardiology Unit is involved in several national and international clinical trials and is particularly expert in the use of drug-eluting balloons and new generation devices such as bioabsorbable stents in treatment of acute myocardial infarction. Thus, it is possible that you will be asked to participate at one of these studies. You will remain anonymous. All these studies have been previously authorized by Ethics Committee B of Milan. We also organize a certain number of scientific courses and meetings, one of every 2 or 3 months, with invited faculty coming from all over the world. The Interventional Cardiology Unit is organized to follow patient after percutaneous intervention for at least up to 1 year. Moreover, it is possible that for your own interest, a new angiographic control after several months will be required. Medical doctors, nurses, and all the staff of the department are always available to clarify any doubt. Nevertheless, it is very important that you carefully read the informed consent that the staff brought to you.